as a flight doc on the military side and the civilian side, especially with your expertise, what do you think is the most important part about, keeping your mental health good while maintaining your medical?
Yeah, that's a big question. Um, yeah, I mean, I think it's great that you guys do this mental health minute. First of all, just because I think it's something that a lot of times we just don't talk about. I think a lot of times as high performing males, it's like, I got this. I got this. I can handle this. I'm good at stress. I'm good at dealing with stress. So just recognizing that we're all just human and that there is a breaking point. It's gonna even even like the well trained fighter pilot, although that breaking point is probably to the right of the normal curve where it would be for just your average person, there is a breaking point. And kind of getting to understand, like, where is your breaking point? Where's that point where, hey, shit, I need to get some help? You know, if you're feeling that way, you just need to get help rather than just kind of trying to just dig in deeper and not asking for assistance. And the way to do that, I think it's going to vary for each individual. Do you go to your squadron commander? Do you go to the flight doc? You go to someone that you trust and that has your best interest. Start there, um, and then just ask for that help. Right. Um, I've been loving doing the HIMSS program because they're some of my favorite patients because most of these people have already reached that point. They've been dealing with for years. And you have all my HIMSS patients, by the time they see me, hearing what their last couple years were like is always a nightmare. And they've gotten to the point where now they're asking for help and they're getting that help. And then on the other end, when they come back and maybe they're actually out of the cockpit for a little bit, but we get them back up, they're new people, they're reborn, their relationships are better with their families, they're performing better in their job, they just have a new zeal for life. And seeing that whole transition in so many different people has been really rewarding for me. And that could be any of us, that could be me, that could be you guys. Maybe not Gonki because he seems like he just has just
He's a
rolls
golden
off his
retriever.
back type of.
Yeah, he's a golden retriever. Human golden retriever.
Life is so good. I don't know. What's the big deal?
I'm just happy. I'm just happy to be here.
My tail's always wagging.
Dude. I know that's a lot of generalities, but in general, I think you just know that you have a breaking point, know what it is, and ask for help if you reach it.
So you talked about the 3 drugs. And what currently? I mean, so I've always talked about things that have helped me, as far as in the squadron, just talking, there was non-medical counseling within the squadron. They started having military family life counseling actually embedded in the squadron. So you could go talk to them. And as long as you weren't a threat to yourself or somebody else, it stayed confidential. It didn't go in any medical records. You could just get stuff off your chest. And then it escalates to a psychologist, psychiatrist, and it goes from there. What part in that process does it go from, this is not a threat, I'm just getting stuff off my chest, to, okay, you're not going to fly, we're going to have to ground you for X amount of time? Where have you seen that or is there one? Is it just a case by case basis?
No, these are great questions. And I think you're looking for more specifics, and it is somewhat of a protocol. So, if you're having just like, hey, I just need someone to talk to about stress or increasing resilience or helping with sleep or behaviors or things like that, that's like the lowest level. You go see a therapist. Once you get to a position where it's like, there's actually a medical condition called adjustment disorder. And it's something that's probably overused in the military or by anybody that's a pilot because of the specifics that it has less ramifications. And so essentially there's something external to you that has happened that has given you some symptoms that overlap with like depression or anxiety, right? And there's very specific definitions for that diagnosis. It can't last longer than 6 months. There's very specific types of symptoms that can or can't be part of that process. And so if you then now have gotten so severe that you're no longer meeting criteria for adjustment disorder, your symptoms have been prolonged enough or severe enough or intense enough that you need to maybe explore, like, actually, do you meet criteria for major depressive disorder? Even if it's just like there's actually even different levels of that. Major depressive disorder, like mild, moderate, severe, generalized anxiety disorder. There's different psychiatric conditions that actually have diagnostic criteria. If you meet one of those ones and you actually are going to start taking some type of treatment, like an antidepressant, like you were saying, there will be downtime. And so that's kind of like, and I've met plenty of pilots that get to that point. You're like, you know what? I've been trying to do it this way. I've been minimizing my symptoms intentionally to try to use these different modalities that won't affect my career to mean that I can continue flying. And I'm done. I'm ready to try something else. It's just not working for me. I'm unhappy in my life. And I think there's a time always when like the pilot starts to say like, I'm more than just a pilot. You know, I want to be healthy. I want to enjoy my life. And a lot of times we see that at the end of a military career, you know, guys that have been flying for a couple of years and they're just struggling in a lot of different physical and mental ways, but they're still trying to do it. And then they're like, hey, you know, I need to deal with these things. And that point's going to cross differently for each person. But I mean, for the FAA and the Air Force, you can be on antidepressants and get back in the cockpit. So you get on the medicine, you do some therapy. I mean, as far as evidence for these treatments, if you have depression, the evidence suggests that cognitive behavioral therapy, which is a type of therapy combined with certain medicines, gives you the best likelihood of resolving that condition. You know, those two things combined. And so, yeah, I don't know if I specifically answered your question, but I think that,
That's awesome.
that people don't realize that there is a path to get back in. Yeah.
Yeah. So it's not one and done. There's, in most cases, there is some sort of roadmap to getting back to flying, even if that involves pausing for a while to take care of whatever the problem is.
Yeah. And the pause is long though. I mean, the pause is usually 6 to 12 months, which is a long pause, you know, if this is your career and stuff. And, this is what you love. So it is I mean, there's a lot of obstacles to being that person to say, hey, I need some help versus just anybody else on the street that doesn't have to deal with, you know, their career or their passion being impacted for anywhere from 6 months to a year or two. You know, that's a huge ask, but it's possible.
So one thing I have seen with airlines now, which, you know, airlines, you've got the union, you've got the aeromedical folks in the union, but airline contracts have now moved towards including mental health as part of their long-term disability plans. So whereas before, you know, you needed something like medical diagnosis, whatever, now it's okay, you've got some kind of mental health thing going on, you get paid time off through the insurance. So I think that's awesome that they do.
Yeah, it's a big incentive
that they do that. Are you dealing with, so as the HIMSS person, you're not counseling them, you're just helping them get their medical back? Is that how it works? Or are you like kind of walking them through, you know, who to go see and what to do? How does that work?
The HIMSS AME is kind of like the equivalent of the primary care doctor for, you know, just standard medical care. They're kind of like the quarterback. So patient comes to see me, maybe they want to get put on they're going to start an antidepressant. You know, they're going to need to go down that special issuance pathway and get that waiver. I'm kind of explaining to them the process. It can be a somewhat complicated process. There's lots of different steps and moving parts and evaluations that may be needed. So there's also like a HIMSS trained psychiatrist if that's a requirement. There's also a HIMSS trained neuropsychologist if that's a requirement. I have the names and numbers of all those individuals. I'm helping them set up those appointments. I'm reviewing those evaluations. I'm running a checklist, making sure that when we're ready to submit everything, we get to that point of submission as quickly as possible. And we're not going to go back and forth with the FAA and exchange a bunch of messages. And every time, you know, those messages take months. You know, you send something to FAA only to get a letter back saying, oh, you forgot your personal statement and you just lost 3 or 4 months. So the HIMSS AME is trying to make sure those things don't happen, and review everything. And based on, you know, your expertise and experience, you have to also then write up your final report as well, based on everything you read of how this person's doing. And that also applies with, you know, patients that struggle with alcohol. You know, that's a whole another huge program where the airlines are really involved with that too. And most airlines have their own HIMSS rep within the airlines that I'm working with and coordinating with. They're sending me all the stuff and I'm reviewing it, and I'm kind of setting up the calendar and the timetable to get someone back on status and help them get there.
Can they do this virtually, or does it all have to be in your office in person? Like, is it just for people in your region that pretty much, or how does that work?
Because there's just not probably enough HIMSS AMEs, I do have a lot of patients that are located in different places. There will be an occasional in-person meeting. Usually the FAA letter will say you have to do half of your meetings with your HIMSS AME in person. And that usually coincides with their actual certification exam. I mean, you have to do the exam in person anyways. So a lot of the actual meetings can be done remotely, but when they come in for an exam, you know, to do their annual class 1 physical where they have to, you know, maybe get the EKG, do your analysis, check their vision, all that stuff, they physically have to be there. There are some scenarios where the specifications may be written that you need to be in person more frequently. So it kind of varies on a case-to-case basis. But I have patients all across the country.
Wow.
That's awesome.
That's awesome.
Wow.
Yeah.
I appreciate that information. This is, I mean, we talk about this every week, right? You know, at the very least, talk to somebody. But if you're feeling at any kind of point that, hey, I can't do this anymore, 988, 911, you know, phone a friend. Don't ever let it get to the point that, you know, don't make a temporary problem permanent. And
Yeah.
I appreciate the fact that, you know, you do that and you've been on the channel. So awesome.